How do phase II enzymes affect species-specific toxicity? Phase II enzymes like UGTs and GSTs conjugate toxicants, aiding detoxification. For example, cats lack functional UGT1A6, leading to acetaminophen toxicity. Turkeys can't conjugate a flat-oxan B1 epoxide with GSH, making them vulnerable to aflatoxicosis. In contrast, rats efficiently detoxify via GSH conjugation. Why are cats sensitive to phenol-based compounds? Cats lack UGT1A6, impairing glucuronidation of phenols, including acetaminophen, NSAIDs, and pyrethroids. This leads to toxic accumulation and oxidative damage, including methemoglobinemia and Heinz body anemia. How does the absence of NAT enzymes affect drug metabolism in animals? Dogs lack both NAT1 and NAT2, impairing arylamine detoxification. This leads to adverse reactions with sulfonamides, such as fever, anemia, and liver necrosis. Cats lack NAT2, making them partially susceptible. What is the role of CYP enzymes in metabolic bioactivation? CYPs, especially CYP1A and CYP3A, often activate toxicants. For example, a flat-oxan B1 epoxide, by CYP1A, DNA damage. Diazinon diazoxan, by CYP2B, active anticholinesterase. Bioactivation can enhance toxicity, depending on enzyme presence and activity. How do GST enzymes protect against aflatoxicosis? GSTs conjugate a flat-oxan B1 epoxide with GSH, preventing DNA binding. Turkeys lack efficient GST isoforms, making them prone to liver damage. Rats and adult chickens exhibit stronger resistance due to better GST activity. Why are greyhounds prone to drug accumulation? Their low body fat reduces distribution volume for lipophilic drugs like thiopental and organophosphates. Combined with reduced CYP2B expression, this increases plasma concentration and prolongs drug effects. How does the MDR1 mutation alter drug response in dogs? MDR1 deficient dogs, for example, collies, cannot exclude PGP substrates from the brain. Drugs like ivermectin, acepromazine, and loperamide cause CNS depression, tremors, or coma. Effects absent in wild-type dogs. Why are sheep susceptible to copper toxicosis? Sheep of low G6PD reduced GSH recycling oxidative damage from copper accumulation. Stressful events like shearing trigger copper release, leading to hemolysis, jaundice, and death. How does age affect toxicant metabolism in young animals? Neonates have immature liver enzymes and inefficient renal excretion. Calves and piglets poorly detoxify pesticides like pyrethroids or organophosphates due to lack of functional rumen or low UGT activity. What makes piglets more vulnerable to zearalenone? Piglets have underdeveloped glucuronidation pathways and absorb zearalenone and its estrogenic metabolites via milk. This leads to hormonal imbalance, vulvovaginitis, and reproductive issues. Why do young animals absorb more heavy metals? Neonates show higher pinocytosis in gut epithelium. Lead, cadmium, iron, and mercury absorption may reach up to 90% in young individuals compared to adults. Lead, for example, accumulates in bone and brain tissue. How does aging impact toxin clearance in animals? Elderly animals may show reduced renal clearance due to lower GFR, though hepatic enzyme function may remain stable or increase. In aged mares, hepatic CYP expression can even rise, altering drug metabolism. How does stress influence toxicity? Stress can trigger toxicosis. In sheep, stress induces sudden copper release from the liver. In strychnine-exposed dogs, minor stressors like light or sound can precipitate fatal seizures. How does starvation affect drug metabolism? Food or water deprivation reduces liver enzyme activity and antioxidant reserves. Calves dosed with paracetamol show decreased glucuronide and sulfate conjugates, increasing the parent drug's residence time and toxicity. What is the effect of inflammatory disease on toxin metabolism? Acute phase reactions suppress CYPs and UGTs, impairing detoxification. Inflammatory cytokines also downregulate PGP transporters. This increases the risk of toxicity for drugs cleared by these routes. How does pregnancy alter xenobiotic kinetics? Pregnancy increases plasma volume, fat stores, and alters hormone levels. These changes modulate enzyme expression. For instance, CYP3A activity may increase, while CYP1A2 decreases, changing drug clearance unpredictably across species. What is the risk of toxin excretion via milk during lactation? Lipophilic toxins like PCBs and PCDDs are excreted in milk, reducing the mother's toxin load but exposing sucklings. Zearalenone in sow milk causes estrogenic effects in piglets, tremetone in cow's milk causes milk fever in calves. How do milk-borne toxicants cause offspring syndromes? Substances like pyrrolizidine alkaloids, from Senecio spp. And glucosinolates, from Brassica spp. Pass into milk, affecting neonates' liver, thyroid, or causing growth retardation. Milk from intoxicated lambs can transmit cyanide or even metaldehyde. Why do small particle sizes increase toxicity risk? Fine particles absorb faster and cover more mucosal surface, increasing bioavailability. For irritants like Greek letter alpha naphthalthiourine or zinc phosphide, this intensifies vomiting or local damage, accelerating systemic effects. How does improper pesticide storage increase toxicity? Some organophosphates, for example, diazinon, form highly toxic isomers like TEP upon prolonged storage. One case involved lamb deaths after using 15-year-old dip solution containing toxic breakdown products.